I'm gonna do this one in English because I'm gonna read in English, but I hope you're gonna understand. I was talking to a friend that I'm gonna tag. You're gonna know. You're gonna know. We were talking about like light exercise when you are hypermobile, and basically I was like talking about what I have in my mind, and I forgot that I have this book that I'm reading currently. I will at some point give my opinion on it. I already have some hot topic on it, but I want to give it a fair trial before. So I'm just at the beginning for now. So it's Living Life to the Fullest with Ehlers-Danlos Syndrome, a guide for a person living with EDS to achieve a better quality of life, from Kevin Muldowney and Kathleen Muldowney, both are PT, physiotherapists. Now, if you research who are the Muldoneys, there are PTs talking also with the Ehlers-Danlos Society, and they have made a protocol, the Muldowney Protocol, to strengthen the EDS patients. So I'm not saying that what they propose is bad at all. I just am concerned about some stuff that I'm reading that seem a bit too much promising for some patient, but also I want to read the full content because maybe at first they make big promise and then maybe it's more nuanced at the end. I don't know. And yeah, and I don't think that they make exercises that they are like really bad for people. Also, they say like they should like go with PTs and stuff like that. This book is really expensive though. I ordered it a while ago, and also it's so heavy. It is not EDS friendly. It is so heavy. I can't go anywhere with this book. So it's really a book that's a home. The good thing with this book, though, is there's a part for physiotherapist and there's a part for the patient. I like to read both because I want to understand both. What I want to read now for you, my friend, that we discussed earlier, is one exercise that is the first exercise that is recognized by Muldowney. Muldowney says basically that is the first exercise that a patient must be able to master before doing anything else. That's one of the things that I don't really agree with the Muldowney Protocol for now, but maybe at the end of the book I will change my mind. But basically, Muldowney say that patients should do in a specific order everything, and they should do this. And when they do this, they should not do anything at all. I personally disagree. I will talk with my PT about that. I might be wrong, but I'm gonna read this exercise. I think it's a good exercise and it might be helpful to you. Um, so it is supine abdominal bracing. Position. Lie on your back with knees bent and feet hip width apart on the mat. Perform pelvic neutral with abdominal bracing, holding for 10 seconds and relaxing for 1 second. Repeat this process for 1.5 minutes. Pelvic neutral with abdominal bracing. This is defined as a range of motion somewhere between the low back, between fully arched and fully flattened, in which the position that the low back is in does not hurt. This position is different for every person. Find pelvic neutral, then take your hands and place them on the front part of your hips. Find the two bumps of your pelvic, ACEs. So it's uh, that your physical therapist will teach you to find. From the bump, move your hands 1 to 2 inches inward towards the midline, belly button. Press your hands into your stomach and say the words ha ha ha. The muscle contraction you feel under your hands in your transverse abdominis. Now pull your belly button in while performing a Kegel exercise. tighten as if you were attempting to hold your stream of urine. You will feel the same muscle contraction as when you said ha ha ha. If you feel this, you have achieved pelvic neutral with abdominal bracing. Hold pelvic neutral for 10 seconds, then rest for 1 second. Repeat this process for 1.5 minutes. Progression. Begin this exercise at 1.5 minutes and add 10 seconds each day until you reach 3 minutes. When you reach 3 minutes for this exercise, you are ready for level 1 mat exercise. You should feel these muscles working with this exercise: transverse abdominis, lower stomach. And then for the physical therapist, a pillow may or may not be used for this exercise depending upon the pain level in the neck region when performing this exercise. Make sure the patient's knees and hips are in neutral, not rotated, to avoid hip, knee, or ankle pain. I'm going to show you a picture. So that's the picture of the position. It looks simple enough, and I know you have done quite more exercise than me. So maybe for you it will be a piece of cake. I can tell you that for me, it is absolutely not. And I've been doing PT exercise for like quite intensely for a few years now. But to be honest, we didn't work that much that area of my body. So that's the reason why I started to go with that book now, because I was like, oh, they said to start with that area of the body, and that's currently close to the place I have currently pain now. So that's the good point for me to give it a fair try. So yeah, I am really struggling to do it. Also, I am really struggling personally. That's probably the artistic brain in me, to add 10 seconds each day, because when I do an exercise, I want a full number. Like I don't do repeats. I want a minute or 2 minutes or 3 minutes of an exercise to put in my notebook. I don't want 1 minute and 10 seconds. I don't want 1 minute and 40 seconds. That's brain fucking me. So I'm trying to do it for as long as I can, and when I can't, I'm like rolling my pelvis. That's good too. That's a good exercise that I've seen from Jenny DeBon. That I recommended to you, like Jenny DeBon in private. That's good recommendation if you're looking for exercise for hypermobile body. But yeah, it's quite a challenge. I don't know when I will be able to reach for the 3 minutes at this point. But you would assume like doing something lying on your back wouldn't be that tough. Personally, I think it is. I like way better like lifting weight at this point. I would like admit though, I don't lift like heavy weights. I would admit that, but I lift weights anyway. So I feel, yeah, but it's funny. So I hope it helped a little bit. It give you one little thing, and I will maybe like go further as when I progress. I wanted to try to show how I do those exercise. But as I told you, dysphoria is a bitch. So yeah, I love you, and I love every other people trying to exercise with hypermobile bodies, or not hypermobile bodies. Just trying to survive in life, exercises or not. Like, we are doing our best. Anyway, love you. Bye.